Dr. Morales, thank you so much for joining us on MD Newsline podcast. Can you please introduce yourself to our audience?
Sure, yeah. My name is Justin Morales. I'm an addiction psychiatry fellow in the Mass General Brigham Harvard Medical System. Went to undergrad down at Southern Methodist in Dallas, went to medical school at Howard University in DC, and just finished my psychiatry residency at NYU out of New York. Very happy to be here. Thanks for the invitation.
Wonderful. So, we're going to talk about addiction today, which
Awesome.
is always a hot topic. I
Yeah.
feel like it's so relevant. When you think about the addicted brain today, how has our neurobiological model of addiction evolved beyond the older linear, maybe reward pathway story many of us were trained on?
Yeah, I think right now the way that we're trying to develop and think about it is what we're kind of colloquially calling like the biopsychosocial platform. And so that takes into the biological components, which you were alluding to, the neurocircuitry. We know there's some genetic components related to addiction, but also the next part, biopsycho, so psychological components. This is the individual's temperaments. Are they risk averse, risk seeking? Are they more experimental in their actions or more reserved? And that's usually, can help dictate treatments that we're talking about. And then the social element also leads to, again, as it suggests, the social dynamics, the environmental factors, the family that they grew up in, the social economic status that they may align with, the different areas that they grew up in, and just kind of more external influences. And so when you look at it from that way, you can incorporate multiple different treatment modalities from obviously medications, which we would align with more of the biological components, therapies, which align with the psychological components, and then we could working to engage like social workers, case managers to help with kind of the more social needs that individuals need. So it provides a more holistic treatment rather than just solely saying, because somebody uses a substance that it's going to solely just affect the biological components they have. We recognize there's multiple factors that are at play.
Hmm. How do you clinically distinguish between the classic substance addiction, such as alcohol, opioid stimulants, THC, and the newer wave of behavioral addictions like social media, gaming, binge eating, in terms of phenomenology and brain circuits?
Yeah, so I think, the classic way of thinking about it is still trying to use similar DSM-5 criteria for substance use, but obviously adapting it to whatever modality it is that you're speaking about. So let's say we're talking about like social media, for example, or over internet use. When we look at the classical criteria, you're thinking about tolerance and withdrawal, which may not apply as much when you're thinking about like internet or social media usage. But what you can consider is the idea around how much are you using? Are you using more time on these devices? Are you talking about how they interfere with you on a social level? Procrastinating, missing deadlines. Are you maybe isolating and staying inside and just on your phone rather than actually interacting with people in an environment and on a personal level? And then less so with social media, but can be a potential element is like high risk things. Like, are you engaging in risky behaviors, things that can actually ultimately harm you either physically, psychologically, mentally, emotionally? So when you look at that, it's not in the DSM, which is the manual that we use for diagnostic criteria for all psychiatric illnesses, but you can kind of adjust those different parameters to make it adapt to that. And from there, you can kind of assess how severe they are based on how many criteria of those they may meet.